Because I think there were just slides. I don't believe there were any more questions within those slides, right? Yeah. Don't worry about those then. For your own edification, you may want to look at them, but it's up to you. All right. So the adult structures. There we go. You have the trachea, which branches off into the primary bronchi, and those primaries branch off into the secondary. The secondaries branch off into the tertiary bronchi, and you just keep getting these smaller and smaller little divisions of the respiratory tubes. And so the lung buds divide into the two bronchial buds, and so you have the primordial pharynx, right, which then you get that little pouch, the laryngotracheal diverticulum, and that starts to expand and go down, and then that becomes the lung bud. It just kind of changes names. It's the same structure as it elongates and continues further down into the splanchnic mesenchyme. And then there's a little bit of confusion about lung buds versus bronchial buds sometimes. And I'm not sure if Dr. Felix covered it. The lung bud is the one bud that's growing downward into the splanchnic mesenchyme. And once mutation occurs and it starts to split into two, then it's known as the bronchial buds, because those are the buds of the bronchi. At least we get one more person. And so as those bronchi expand outward, they're growing into the pericardio-peritoneal canals, which will in the future become the pleural cavities. Okay, here we have this figure again showing at 5 weeks the embryonic development of the respiratory system. And at this point right here, you can already see the bronchial buds. And again, they're referred to as the bronchial buds because there's already two of them, and they're starting to split off, from the trachea. So here we have this familiar figure. We've seen this before. It's the cross-section of the embryo. And this would be at, let me go ahead and switch back to the previous slide. This would be at about this plane right here, where it comes between the bronchial buds. And you can see that because there's already two of them. And on this figure, it's labeled the lung. And the bronchial buds will develop into the lungs. But so we're looking at a cross-sectional plane below the bifurcation, so inferior to the bifurcation, and superior to the expanding portion of the bronchial buds. And again, as I said, they're growing outward into into the pericardio-peritoneal canals. And here we have, as we've seen before, the lateral pleuroperitoneal folds growing in, and they're going to be pinching off this area and separating the cavities. Here we have the little baby. Let me turn off the lights for you. This will help with this figure. There we go. Is that better? Yes. Okay. This was done, I believe this is an X-ray. And what they did was they infused the fetal lungs. This is a cadaveric fetus, unfortunately, fetus. And they infused the lungs with some sort of medium that is that appears denser on an X-ray. And from that, they were able to develop a three-dimensional image and structure of the embryonic respiratory system at this stage. And we'll see the three-dimensional structure in a little bit. Okay, so here we have, again, another cross-sectional plane. This one is, again, below the bifurcation, and here we have the two bronchi. These are in the adult, by the way. We have the two bronchi here. You have the lung structure in pink. In red, we have the visceral pleura. In blue, we have the parietal pleura. And then between the two, we have the pleural cavity. And the pleural cavity isn't empty. It's filled with a serous fluid that provides lubrication for all the structures involved so they don't kind of stick together. And of course, if you look at it, there's all kinds of vasculature also involved in getting the oxygen into the bloodstream and the waste products out of the bloodstream. And all of this vasculature has to develop within the splanchnic mesenchyme. And what happens is that the invading vasculature, as it's pushing into the mesenchyme, it triggers the mesenchyme in front of it to differentiate into vasculature as it progresses deeper and deeper. So it's kind of this chain reaction that's affecting the mesenchyme. So it's not just growing and pushing in, it's actually growing and causing the area it's growing into to develop into the vasculature. Okay. A premature baby has difficulty breathing. However, the respiratory system is developed enough for survival by, do you have any ideas? 28 weeks. It's letter C. And there's several reasons for that. One of them has to do with a surfactant that's secreted, and we'll get to that in a little bit. And then the other one is what I just mentioned. The vasculature doesn't develop right away, and so the actual structures of the lungs are developed way earlier than the vasculature is. And so you have the lungs there waiting to get surrounded by the capillaries in order to do the gas exchange. So if a baby's born prematurely, by the time that the lungs are done, but before the vasculature is done, it doesn't do any good. The baby won't survive because they won't be able to breathe right. Okay. The layer of visceral pleura also acquired from the splanchnic mesenchyme, while the parietal pleura is formed from the somatic mesoderm. We'll see a figure for that. But this is what Dr. Felix was saying about like the balloon effect, is that you have the splanchnic mesenchyme, and then you have the lung buds pushing out, but it takes the outer layer with it, and so it ends up doing on this side because I'm off the little picture. Doesn't the picture-in-picture usually appear up there? Okay. Yeah, I can see it down here. So as the lung buds grow out, they'll push the outer layer of the splanchnic mesenchyme with it, and eventually that ends up surrounding the whole thing, and that becomes a visceral pleura. And so here's a figure of that. As these lung buds grow out, they take this red layer, and that will become the pleura, the visceral pleura. It is sort of used interchangeably. I'm not sure exactly what the cutoff point between when you call it mesoderm and when you call it mesenchyme is, but I know mesoderm is earlier. Call it mesoderm, and then at some point you really ought to be referring to it as splanchnic mesenchyme. this figure, I believe at this stage, should be labeled splanchnic mesenchyme. But to answer your question, they are basically the same thing. And so you do have two different origins for the visceral and pleural, visceral and parietal pleura, one coming from the splanchnic and one coming from the somatic mesenchyme. See, now I'm doing it. Now here we have this figure, which is a dorsal view. We're looking at a horizontal section, and we're looking down through the pericardio-peritoneal canal, and it's actually pretty hard to see, but it's this little white space right here. It's labeled, and that's the canal. And so we see the left lung and the right lung both pushing out into this area, and eventually they will fill the canal. Here's the dorsal mesentery. You see the esophagus up at the top. The middle mediastinum, which contains pericardial sac in the heart. And here again we see labeled ridge, the pleuropericardial folds, which separate the peritoneal cavity from the abdominal and pericardial cavities. Okay, here we see, excuse me, a figure a lot like the previous one, except there's already more branching occurring, and this is a little further into the development of the respiratory system. And as you can see, like I was saying, as the lungs grow out, the visceral pleura surrounds the entire structure that's coming about, including going into all the folds and all of that. There we go. Okay, now here's a three-dimensional view that we were discussing earlier. Here we have the posterior, superior, and inferior views of the lungs. I don't know what stage this is at. It's a good question. So that's just a neat figure. I like it. Here's this happy guy. And so here we have the adult structures. And embryology is kind of interesting like that because it's sort of a give and take. If you know what the adult structures look like, you can see the development and make sense, understand why things go where they do. So here, you have two lungs, you all know that, and they're divided into the lobes. Here we have the right upper lobe, the right middle lobe, and the right lower lobe. And on the left lung, you only have two lobes instead, the upper and lower lobes. So, of course, there's other structures involved, as we see here in the little, what do you call that little box? There's a name for it. I can't think of it. But the rest of the somatic mesenchyme differentiates into all the structures. So from that you get the ribs, the costal cartilage, the vasculature, the musculature, and the dermis at that layer. Important thing to know about the lungs are the hilus, which is right here. The hilus is the point where the structures enter and exit the lungs. So, I'm sorry? The structures, at this point, it would be the bronchi. So like you have the lungs surrounded by this whole membrane. At some point, that membrane has to give in order to allow the bronchi to go through. And that point right there is known as the hilus. Okay, so now if you notice where the hilus is, there is a portion of the lung superior to that particular point. So as the lungs are growing in, let me go back a couple slides. Here we go. There we go. Primarily, the lungs are growing downward and outward, or expanding out this way. But you do also have some growth upward and outward. And so it's sort of, as it's pushing in, you have this radial growth. And we know that has to occur because there is, like I say, some part of the lung above the hilus. And this is known as the apex, kind of like a triangle. Get the lungs more sort of like a blunt cone. And that top part there is known as the apex. Now here again we see the parietal pleura and then the visceral pleura. And between the two we have that pleural cavity, which, like I said, is filled with serous fluid that just provides a frictionless area so that when you move around and you're jogging, your lungs don't actually roughly contact the external surface of the pericardial cavity. All right. Pleural cavity, not the pericardial cavity. If you have lungs in your pericardial cavity, you've got a bigger problem. And so the serous fluid is just there to protect the mesothelium. And actually having a lack of that fluid causes a lot of pain when the visceral and parietal layers adhere, and they actually do kind of stick as you're moving around. That causes a lot of pain, and that's known as pleuritis, which you don't have to know. Just let you guys know. It does happen, but it's not good either. Okay. By week 5, the right and left primary bronchi are formed. So the lung bud has already branched off, become the bronchial buds, and further developed into now the bronchi. And the right bronchus has a larger diameter and has a steeper angle of descent. So whereas the left one's kind of coming out, the right one's going almost straight down, at least for a little bit. And does anybody know why that makes sense? What do you have on the left side? The heart. We've got to make room for that. And so the left one kind of moves off to the side and has a smaller diameter in order to accommodate the heart. Now, one of the interesting things is that because the right bronchus has a larger diameter, bigger around, and is more vertical, whenever you accidentally swallow something, whether it be a fluid or a solid, it's much more likely to go into the right bronchus and end up at the right lower lobe down here. Bronchi, and this one kind of comes down here. You're more likely to end up down here than you are anywhere else in the lung, whether it be anywhere else in the right lung, and especially much more often than the left lung. There we go. You can see right here. This one is bigger around and is just kind of straight down. And it's a lot easier for something to become lodged in there. And that's known as aspiration pneumonia. Okay, so the primary bronchi divide into secondary and tertiary bronchi, and that forms the lung segment. The cartilaginous plates, which are the little cartilage rings, those develop from the splagmic mesenchyme, as does the muscle surrounding the bronchi. Is there anybody downtown?
No.
Yeah. I'll turn that mic off. Thank you. I don't know if they did or not, but I don't hear it anymore. Okay, so here we have a figure from the text, figure 11.7, and that just shows some of the different stages of the bronchial development. And so here at 28 days, we have the trachea. This is kind of your zero order branching, and then you have your one branching, and so these are your primary bronchial buds. And actually, by this point, you've already got a secondary branching. So this would be the trachea. We'll just call that 0. This would be the right primary bronchus, and these would already be the second bronchi, or bronchial divisions. By 35 days, which would be the end of the 5th week, so beginning of the 6th week, you'd have 1, 2, 3, 4. You're already into quaternary bronchioles, and I don't think there's a name after that. So by the end of another week, 42 weeks, the end of the 6th week, beginning of the 7th week, you're already starting to see the developing lobular structure, the gross anatomy of the lungs. And so here we have the right upper, right middle, and right lower lobes, and the left upper and left lower lobes. And here we can see that even more clearly. Also, sometimes instead of upper and lower, superior and inferior are used. It's the same thing, of course. And so again, here we see the right main bronchus and the left main bronchus coming off the trachea, and then just you keep dividing. You go, a layer off that, another one off that, another one off that, and there's actually between 18 and 24 different branches, different orders of branches. So whereas this one's a primary, this one's a secondary, this one's a tertiary, this one's a quaternary, if you can imagine, making about 20 more subdivisions off that, and that helps to provide the little bitty alveolar structure and create extra surface area like that. And the lobes are further divided into lobules. So this diagram doesn't show it, but something like this would be a lobule. Just a smaller section, and whereas this branch right here kind of determines where the lobe, is, we could say, for example, this branch would determine that this is a lobule. So it's just like a smaller structure of the lung, a substructure, more appropriately. Okay, here we go. This is a structure from an anatomy book of the lung, and again, you can simply see that it's divided up into progressively smaller portions up until you get down really, really tiny. And one thing this allows you to do, if you have a diseased or damaged part of the lung, you can actually do a partial lobectomy. Instead of replacing an entire lung, if there's only one section of it that needs to be fixed, you can just replace that. Okay, here's another figure. Here we can also see the cartilaginous rings surrounding the trachea and the bronchial structure. All of these rings are C-shaped, so if you're looking at it, say from this aspect right here, then you have the surface of the trachea right here. And of course this would be in contact, but I'm going to draw it not in contact to show. You'd have this cartilaginous ring surrounding the trachea. It's actually a C-shaped ring. It's not continuous. There's a discontinuous portion posteriorly. I'm just trying to fill that in so it's clear. And so out in the back, it has this area that's not continuous, and each of the rings is also discontinuous with each other. So the cartilage provides both structure and protection for the tracheal passage, yet it's flexible enough because it's open at the back, and it's kind of like your ribs. You know, they're separate, and so it allows it to bend. Yeah, it does. And right here, you have this differently shaped ring, which it has to be if you think about it. You've got all these C-shaped rings, and you have to have one that kind of allows the tracheal structure to bifurcate. And so this particular ring has a ridge running through it. It's kind of like that, but then it's got this little ridge here. And so it provides this bifurcation area. And that particular ridge is called the carina, C-A-R-I-N-A. Again, one of those things you don't really need to know. But just so you know how this particular ring is different and provides the support for the two bronchi. Okay. What week are we looking at? We're looking at 17 weeks. By that point, all the major components of the lungs are completed. So the lungs have their structure. They look good. Look like it's ready to breathe, but you're not. And again, one of the reasons for that is that the vasculature hasn't developed. By week 25, you have the immature alveoli, and the lung is vascularized, but the viability is slim if born at this stage. Okay, and the reason for that, excuse me, would be the blood-air barrier that still hasn't been formed yet. There's a figure I was looking for. Okay, so one of the questions, this is one of those slides where there's not really a question, there's just kind of a statement. So know the stuff on the slide. It may be a sort of matching-ish kind of question. The question might say, you know, at what stage is a developing lung resembling an exocrine gland? And so for that, you would answer pseudoglandular. But let's just go over these phases. At the pseudoglandular stage, which is between 5 and 17 weeks, and there's actually an overlap between that and the canalicular phase, the developing lung resembles an exocrine gland, at least histologically, and that occurs up to about the 7th month. Okay, here's a figure of that. Now, I never quite figured out how it looks like an exocrine gland. This is a figure of the pseudoglandular period histologically. Just take my word for it. It looks like an exocrine gland, kind of like a sweat gland or something else. And during the last 2 months, the respiratory membrane develops. So this is up to the 7th month, and then in the next 2 months, you get out of the pseudoglandular phase. Okay, then you move into the canalicular phase, which this is a little easier to justify. The bronchi divide into smaller and smaller canals, which is why it's known as the canalicular phase. And this is the time when you have the intense development of the vasculature. And so right here in this figure, you have more capillaries, and at some point they're going to start becoming a little bit more intimately associated with developing bronchial structures. And again, this one says 17 weeks, and this one says 16, so there's a little bit of an overlap between the two stages. And so the terminal sac period is the point at which development starts to finalize, and the lungs will become viable structures, and an infant born at that stage can be viable and can survive. And the reason for that is that the cuboidal lining, and you have these like cube-looking cells. They're not really cubes specifically, but they're about as long as they are wide, etc. These kind of get stretched out, and you've got these really thin cells instead. Little nucleus there. And so because of that, this facilitates gas exchange because the membranes are so much thinner, and we'll see that in a little bit. Here we go. So you have these cuboidal cells, kind of just normal shaped round cells, and then you've got these right here that are really flat. That's all one cell right there. And as you can see, it's really thin, and it's up against the really thin capillary membrane, and what that does is that allows the gas exchange to occur more efficiently, because there'd be a lot more area to go through if it had to go through one of these cuboidal cells. And so here we have the terminal sacs, which is the area where these are the primordial alveoli, and this is where the intimate association between the primordial alveolar structures and the capillaries occur. And this stage continues up until birth. So here we have the alveolar period, which occurs after birth. And 95% of the alveolar structures, the mature alveolar structures, develop postnatally. So again, here we have the really thin associated cells with the capillaries. And now we have these full structures referred to as alveoli. Okay, here we see a slightly larger scale picture of the alveoli. And so you have the terminal bronchiole, which in the larger figure would be about right here. And then that branches off, and on the smaller respiratory bronchiole branches is where you have the alveoli. And so they start right about here, and they're most dense down around the end of the bronchial structures, and they just densely surround it, and each of the alveoli forms this clump that's known as the alveolar sac. Okay, this is actually a pretty good histological picture. I'm going to draw on it. So right here you can see one of those branches of the bronchial structure, and then I'm going to outline these. You can see each of the little alveoli and the alveolar sacs. So it's a pretty good cross-sectional plane. of the alveolar structure. And this little space right before the alveoli is called the atrium. Okay. Oh, here's that. I knew that figure was in here. Here's what I was talking about the thin membrane surrounding the junction between the alveolus and the capillary. And so right here you have one cell, which is the capillary membrane, and right here you have the alveolar membrane. And instead of being these two big cuboidal cells like that, they kind of both scrunch in and form these really two thin cells, and that facilitates the gas exchange just to be more efficient and quicker. So right here, you get a pretty good idea of how intimately these are associated. The capillaries are right here in the middle, and they're surrounded by alveoli on each side. And this, of course, just increases the efficiency, and you know, volume-wise. So each alveolus is surrounded by several capillaries, and each capillary is surrounded by several alveoli. And here we see the type 2 cells. These are the ones that secrete the surfactant. That's made up of phospholipids, and it basically just forms this monomolecular layer. So it's really, really thin, and all it does is reduce the surface tension on the alveolar structures because they're so small and so thin. And it helps to keep them from collapsing on each other. And without the surfactant, the whole lung will collapse, and clearly then you won't be able to breathe. Okay, here's the legend for figure 11.9, which are the different histological figures. And so here we have the pseudoglandular period again. This is the bronchus right here. It makes sense because it's the largest structure we can see here. And these are the primordia of the alveoli. So all these little structures, and I'm sure some of these are capillaries. I honestly can't tell the difference. Yeah, I don't know which one. I don't know which ones of these are capillaries. No. Why aren't they capillaries? Capillaries don't grow in at this stage yet. See, I forgot about that. I almost tricked myself. Okay, so there may be some vasculature in here. It's not developed enough to provide gas exchange capability at this stage. So all these little dots, and you guys might want to look at these figures because they'll probably come back to haunt you at some point. All these little circles here are just the small alveoli that are developing. And here we can see the canalicular period. Here's the main bronchus at that area. And then you have slightly larger, smaller structures. Does that make sense? You have the main big one and then some of the smaller ones, which you had in the previous stage. But here, the smaller ones are bigger than they were in the last stage. And so that just indicates that the lung development is continuing, and this is a little further along in the development. Okay, this next figure is 2 weeks later, but still within the canalicular period. And here you see just some more bronchial structures and the stem bronchus. This is a really good figure. I like this one. This is the terminal sac period, which again is the last period. And here we do see capillary structures. And again, they are surrounding the alveoli. and they kind of form this web around the alveoli in order to provide for maximal gas exchange. Up here we can see the cuboidal epithelium, and this actually doesn't appear too clearly on the figure, but you can sort of see that these cells are a little bit bigger around, and they stain differently. The stain kind of goes further in, so you know the cells are at least bigger in that direction, whereas down here they're really, really thin, which again just shows you histologically what we talked about before. Okay, so the surfactant produced by type 2 cells is necessary to avoid respiratory distress. And so if a baby's born at that stage, they have very little chance of surviving because of lung collapse. Again, you can't have respiration without the pulmonary circulation. Kind of like if you're building a house, you can have as many sinks and bathtubs and dishwashers as you want. If you don't have the plumbing, none of the structures there do you any good. You can't send water down, you can't bring water in, and it's the same thing with the oxygen and the waste products being produced by the body. And so the fetus practices breathing movements, and it brings in amniotic fluid, breathes it out, and that is essential to the development of the lungs. The pressure being put in there kind of gets it ready, and so by the time the baby's actually born, it's had months practicing breathing, because the last thing you want is to show up on the scene and not be prepared for something as critical as breathing. And there is fluid still in the lungs by the time that the baby's born, and there's several ways that's cleared. Thoracic pressure during delivery, you're kind of fitting through this little bitty space, and so it does put some pressure on there, and that helps to push out some of the fluid. Some of it is picked up by the vasculature and just kind of distributed into the bloodstream and cleared that way. And the remainder does stay in the lungs and is usually just physically aspirated by whoever's delivering the baby. This is another really good picture. Here we can see the alveoli and see that they're surrounded by this capillary web network just surrounding them and allowing it to kind of get gas exchange from all around it. And so here we see a diagram of that. And that's pretty much what it looks like. You've got the alveoli, you've got the capillary network surrounding them, and then you've got these elastic fibers holding the whole thing together. And that's what helps form the alveolar sacs. Okay, so if a baby is born at 28 weeks gestation, what major problem will the doctors look for? At 28 weeks, what they'll be looking for is lung collapse, basically, because type 2 cells haven't developed, and there won't be a whole lot of surfactant produced, if any, and therefore the lungs have a very high, almost definitely will collapse in. This you guys can just read on your own. Excuse me? Where does it say that? Oh, I see it. Sufficient? Yeah. I didn't type it. Okay. So again, we come back to the fact that this is a very complex process. There's all sorts of things going on, membranes and spaces and branches, and there's it's not very high, fortunately. It's surprisingly not high given how complex the process is. But there is a chance of having defects. And so one of them, laryngeal web, is the failure to reopen the airway. The other one, which we do have some figures of, involves the trachea and is known as tracheoesophageal fistula. In its most common form, it occurs 1 in 4,000. It does occur more often in males, which I don't understand the reason for. Let me go ahead and scoot up ahead to these pictures. So right here we have the esophageal atresia, which is this little pouch right here where this should be connecting to the remainder of the esophagus. Do we go to 250 or 255? Oh, my apologies. There's really not much left. Actually, there's one thing in my notes I forgot to mention, then I'll let you guys go. Okay, right here, at the beginning where these figures are sort of misrepresented, it kind of just shows that they're pushing in. There's actually this big ball of cells right here. They're very mitotically active and pushing through and leaving behind them this tube, the bronchial structure. But this is shown as a single layer here in the diagram just for clarity. But in fact, it is this big clump that's just, steamrolling its way through. So, okay, I'll let you guys go. Sorry for taking you over. We'll let Dr. Felix talk about fistula. All right, y'all have a good weekend.
Good job, man.
Thank you.